A six-figure business can feel like a painful business where it's like, how do you manage all the tasks that's involved with the business and the practice? Maybe it's been challenging to find competent and reliable staff that you could trust. How do you keep things steady so you have a steady income that can support additional staffing needs to help you grow? How do you strike a good balance between expenses versus revenue so that when you are growing, you are still taking home more versus seeing that get squeezed? And maybe you have an associate or more than one associate, and you're not able to keep them as busy as they'd like to be. You're still feeling like you need to find new patients constantly. There's only so much time in the day and only one of you to go around. And it could feel like, well, where do I start making these changes? It might either feel like there's just a lot of changes to be made and not sure where to start, or just wondering what's the best order to do things that will make the biggest difference. And no matter how efficient you are, there's only one of you to go around. There's a limit to how many people you could see and what you could do. So one thing that's common in this stage of practices is feeling like you are just so busy. There are so many things to do all the time, and it's hard. Your schedule is booked, likely with patients. And then you also might feel like, if I'm not seeing patients, though, I'm not making money. So it's very common for in this stage of practice to feel like it's hard to let go of seeing patients, because you might either be at a stage where it might feel hard for you to let go of seeing more patients because you look at it as, okay, if I'm not seeing patients during this time, then that's like lost income. Or you might already have associates who see patients for you, but still you have a good load of patients yourself too. And because the practice isn't bringing in enough revenue to support everything while still allowing you to take home a good amount of money and even save money for retirement, especially for all the blood, sweat, and tears that you put into your practice. So whenever you get an opportunity to see a patient, you still choose to see the patient, even though really what would benefit you more is if you were able to step more into the CEO role, the visionary role more, and be able to be more strategic about what you're doing in the practice instead of just putting your head down and seeing more patients and working harder. And this is one of the hardest shifts to make at this stage of practice because of this, because what you're likely used to is seeing patients and making income that way. And so part of this is to have a broader vision, and of instead of you being so much in the clinical role, to be able to step out of it and have a bigger vision. What is your big vision? What is it that you're excited about that you would love to change about our healthcare system? And how do you see your practice, your business play a role in all that as you grow more? Because at a certain point in time, you are going to plateau and you're going to hit capacity, whether it is with the things that you're doing right now or whether it is with seeing patients. And so the only way to grow would be to be able to either have a shift in your business model, or it might be in you having help around you, delegating it to other people who can help, whether it's see patients for you, make money for you even when you're not there, or the right support that helps you admin wise and take those things off your plate. Would you love to grow your practice? Would you love to double your practice this year? Would you love to double your income this year? But one of the mistakes that I often see many practitioners, holistic health practitioners make is trying to double from the rearview mirror instead of where you want to go. And what can happen is it can actually feel really hard this way, because the things that got you to where you are right now aren't the things that will get you to where you want to go. So that's one really important thing. Another thing is, do you have a vision that is bold and that you get inspired by? So, many times, if you really think about this, if your vision is achievable in this lifetime, then it's not big enough. And have you ever considered a bold vision, not just, I would love to see more patients and continue to help more people, but what would you love to see change about our healthcare system? And how could you play a role in that happening in a really profound way? And when we work with our clients, one of the things that we do is we actually look at instead of doubling, we look at what is your 10x vision? What is your 10x plan? What is 10 times the people you're helping, 10 times the impact, 10 times the income, 10 times the flexibility, 10 times the freedom? So whatever is important to you, 10 times that, and then work your way back into a doubling plan, then everything becomes easier because it's no longer like growing your practice from the rearview mirror, but instead growing your practice from where you want to go. And you actually don't even need to reach your 10x vision. But if we actually go there and then work your way backwards into a doubling plan, things fall into place more easily. But one of the things about this is that it's not usually something that is really easy to figure out yourself, because many times we might have our own ideas about things and may not even realize certain possibilities that are there for us too, which is why it's super helpful to get help with this. Also, there are ways that you could be growing your practice and helping people that you may not be seeing yet, that someone who is a good mentor would see for you. So this has made a big difference in many of our introverted visionaries, mastermind members, and catapulting, accelerating their growth to multi-6 or 7 figures. And our clients have done that even in a 3 to 4 year time frame as well. And also, do you have the right business model in place? Do you have for this next level of growth? You might have up to this point, but do you have it for the next level of growth? Do you have the right team who supports you in this next level of growth? That way you could work less than you are right now and have more time freed up to be able to be the visionary, wear that visionary hat, and less of the admin stuff and less of the patient load, while having some of that responsibility be taken by someone else who could see patients and make money for you even when you're not there. When you're able to be in more of that CEO role, then you will be able to be more strategic instead of just going with the day-to-day and putting out fires as you see it. What you'll notice is that your practice will grow much faster than you just putting your head down and doing what you can. So at this stage of practice, it'll be really helpful to set it up for it to run without you, so that imagine if you decided, okay, I would like to take time off, then things won't be affected. You can work if you want to, but you also have that flexibility to take time off. And then if something unexpected happens, also that it won't have as big of an effect on your practice as if you didn't have things in place. For example, there was a practitioner who had always wanted to add another stream of income into her practice because she mainly just worked with people one-on-one, but never really got around to it. And it wasn't until she had this scare where it was totally unexpected, where she had to have eye surgery. I mean, she was perfectly healthy, and then all of a sudden she had to have eye surgery. And that ended up being a moment where it hit her like, oh, I need to take this a little more seriously, to be putting things in place to add another stream of income, so that regardless of whether I'm there or not, people are still being helped and money is coming in as well. So for those of you who would love to accelerate growth to multi-6 or 7 figures the introverted way, you're welcome to either DM me or go to introvertedvisionary.com and book a free chat with us, and happy to see how we can help you grow it faster, your practice faster. Also, I'm doing an upcoming masterclass on the 7-figure formula. There is a path to 7 figures, and it's something that can be repeatable. So without you feeling like you're burning yourself out. I'm going to be sharing that in the upcoming masterclass, and you're welcome to DM me, and happy to give you the link to register for it, and look forward to seeing you there.